TTUHSC is gearing up for this year's Cancer Screening and Information Fair. So today we're going to talk about the importance about getting those regular cancer screenings. Today, Dr. Rachel Basinger joins us today from the TTUHSC Jerry H. Hodge School of Pharmacy to talk about the importance of those lung cancer screenings. Now, I want to start off today because you are part of Tobacco Free Amarillo, and that's why we're talking with you today about those lung cancer screenings and tobacco cessation. I just want to talk about, just kick it off, why is getting those lung cancer screenings so critically important for people?
Yeah, because a lot of times, if cancer is caught in early stages, treatment can be done, lives can be saved. And so waiting until we have those symptoms of chronic cough, coughing up blood, not feeling well, losing weight, where you realize something's wrong, and then you get screened and diagnosed when we could have done it years before. So knowing our risk factors, getting screened just at the end of the day saves lives.
Lung cancer is the leading cause of cancer-related deaths. So it's so important that we get those scans done or those screenings done. I want to go a little bit deeper into what those symptoms look like that people need to really be looking out for, what the screenings are, and when should people get them, ideally.
So some of the symptoms, and we want to get screening even before symptoms. So I'll first talk about symptoms and then we'll go into the screening a bit. But symptoms that are kind of classic for lung cancer is going to be like a chronic cough that doesn't go away. Anytime we're, vomiting blood or coughing up blood, that's never a good sign. So that could be that you have, a growth in the lungs. Losing weight unintentionally. That's usually a sign of cancer in general. And then of course you have kind of more of the vague symptoms of, you could have things like chest pain or headaches, maybe a little nausea, maybe some bone pain, things that don't really scream lung cancer, but could be a symptom of it. But we want to actually get people screened before those symptoms occur. Because if they do have like the beginning stages, we want to catch it then and get them treatment. And so the screening is actually really quite easy. It is a X-ray, so it's a low dose CT, and it just takes a few minutes. Lie on the table, and they literally just kind of scan your chest area to look if there's any kind of growth. And so you're in and out in a few minutes, and so it's pretty painless. Nothing procedures to get ready for. And so for something that just once a year, if you qualify, get done just to be able to save your life, I think it's a really quick and easy thing you can do for your health.
So who needs to be getting them? Everybody?
No, not everybody. So most time lung cancer is diagnosed in like the late someone in their late 70s. And again, we diagnose because someone comes in complaining about symptoms when we'd like to catch it before then. And so we want to be able to start screening people as early as age 55 if they qualify. And qualifications are, as you have to be either an active smoker or that you've smoked within the last 15 years. So if you're in your 70s and you smoked in high school and thought it was cool, but quit when you got older, that's way too long ago. We want within 15 years that you've smoked, that you're between the ages of 55, and we do have a cutoff at 80. So at 80 years old, you can stop getting screened. And then it also matters how much you've smoked. And so what we're looking for is a thing called a pack year history. And that number has to be above 30. And a pack year history is literally, you take how many packs of cigarettes you smoke a day times how many years you've smoked that amount. So to reach 30, if you smoked a pack a day for 30 years, you have a 30 pack year history, you qualify. But say you smoke more than that, you do 2 packs a day. Well, then 2 packs a day, as little as 15 years would give you that 2 times 15 equals 30. If you smoke less, a half a pack, you would have to smoke 60 years before you reach that 30 pack year history. So that is something that you can easily go online and calculate, or talk to your doctor and they can calculate that number for you. But if you have a 30 pack year history between the ages of 55 to 80, and you're an active smoker or smoked within the last 15 years, we would recommend that you get yearly screenings.
Makes a lot of sense. Is there any harm in getting those screenings?
Okay, so number one, we're always with anxiety. People, no one wants to go get a test to be told that they potentially have cancer. So you always have that little bit of anxiety. It is a low dose X-ray, so that do have a little bit of radiation, kind of like similar to get your teeth, X-ray of your teeth at the dentist's office. This isn't high radiation by any means, but if we're doing a little bit every year, that's always a risk. And of course, I always talk about wallet toxicity. And so for, if your insurance covers it, great. You still may owe copay, you may owe a deductible. If you don't have insurance, we can always also talk about things, working with our local hospital district to see if they have any charity available for you. But of course, out-of-pocket expenses to have this yearly test is also, going to be something you need to think about when you're scheduling these appointments.
So obviously the number one way to prevent lung cancer is to stop smoking, right?
Yeah.
You guys at Tobacco Free Amarillo offer some tobacco cessation programs that are very effective for people. Can you take us through kind of what that process looks like?
Yeah. So, there are people that, unfortunately get lung cancer who didn't smoke, but a majority of our people who smoke are the ones who get lung cancer. So we want to stop it because it's never too late to quit. Even if you're undergoing treatment for lung cancer, always a good idea to quit smoking. It's the number one thing you can probably do for your health. And so way Tobacco Free Amarillo, we're set up to do multiple things throughout our community. We do have parts that work on prevention. So getting kids from not even starting to smoke, vaping, any of, chew. But I'm more on the cessation counseling part. So cessation means quitting. And so Tobacco Free Amarillo has sent several of us out for training. So we're certified tobacco treatment specialists, and we work with our adults in the community to help them quit. And so it doesn't matter if you're just a social smoker or you've been smoking for 50 years, these programs are evidence-based. Our curriculum is based off the Mayo Clinic curriculum. And what we do is we work with you on two sides, because we know smoking or tobacco use, I work with vapors, I work for chewing tobacco, I work with anybody. It's a nicotine dependence, but it's also a behavioral part. And so working with us as a counselor, either as an individual, in my clinic talking with me, or at one of the group classes that we host in the city, along with a therapy, is going to be more beneficial than either one of those alone. And the great thing about it, Tobacco Free Amarillo picks up the bill. So the classes are free. If somebody is a Texas Tech patient and I see them in my clinic and they can't afford it, TFA covers, Tobacco Free Amarillo's TFA. They cover the cost of the visit. And I can also give you free nicotine replacement therapy. So patches, gum, lozenge, they take care of all that. So that's one less thing you have to worry about when you're trying to quit smoking. And so we have classes in the community, like I said, several times a month. Our website has those classes. You can take a look to see when the next ones are scheduled. Or if you're a patient with Texas Tech or a patient with Regents Health Network, we actually have providers embedded in those clinics as well. So you can have individual help if that's what you would like. But honestly, if you need help, please reach out. We'd love to help you quit, or if family members quit, the more the merrier.
And all of that contact information on the Tobacco Free Amarillo website, can you kind of give it to us real quick?
Yes. So it's just, tobaccofreeamarillo.com. Very easy to remember.
When you've helped people to quit, how rewarding is that? I would think it would be just really phenomenal.
Oh, yeah. Just having something quitting's hard.
Mm-hmm.
I'm an ex-smoker myself. I know what it's like to have to go through it. And then, I have a stressful week and I don't have my cigarette anymore. So what am I going to do instead? And so it's not just the nicotine dependence, but it's also it was my crutch when things were stressful, when I wanted to socialize. And so it's a complete change in your lifestyle, and to see that in somebody else be successful. Working with them when they tripped up, they had a barrier, they come back and say, I need your help. I hung out with some friends and they started smoking, so I bummed one. And letting them know you're human. Let's talk about what you're going to do next time with your friends. It is so beneficial because it's a journey that I've taken. It's a journey lots of people have taken, and to be on the other side of it and watch somebody making that transition, it's the reason why I'm in healthcare.
I love that. That's so inspiring. That's awesome. So we'll put more information up above about Tobacco Free Amarillo, but also want to let everybody know that we've got the cancer screening and information fair coming up in mid-April. We'll have more information available about all the cancer screenings available through Texas Tech Physicians and Texas Tech University Health Sciences Center. Thanks so much for talking with us today. Really, really great.
Glad to be here. Thank you.